My name is Melanie and I'm doing my informative speech on autism spectrum disorder, also known as ASD. Did you know in the year 2000, the estimated total affected by autism was 1 in 150? And did you know that the current findings indicate in the year of 2013, the total affected by autism is 1 in 88, with 1 in 54 being boys? Research indicates that identifying and diagnosing ASD at a young age can enable a child to begin receiving ASD specific intervention services that will have a favorable outcome. According to the Centers for Disease Control and Prevention, there is no cure for ASD. However, research has shown that early intervention treatment services can greatly improve a child's development. First, I would like to talk about public awareness according to autismspeaks.com. Autism now affects 1 in 88 children and 1 in 54 boys. Autism figures are rapidly growing. Autism is the fastest growing serious developmental disability in the United States. Autism can cost an average family about $60,000 a year. Autism receives less than 5% of the research funding of any childhood disease. There is no cure for autism. Secondly, I would like to talk about earlier diagnosis by a doctor and how autism is treated. And this is according to autismspeaks.com. A doctor unfamiliar with autism may dismiss a parent's concerns, delaying proper interventions. Parents need to trust their instincts and find a doctor who will listen and refer them to the appropriate specialist. Autism organizations are working hard to raise awareness for physicians. The child may receive therapeutic activities up to 25 hours a week. Highly trained therapists and teachers can deliver the intervention. Well-trained paraprofessionals may assist with the intervention under the supervision of a highly trained teacher. The therapy is guided and well-defined with learning objectives, and the child's progress is evaluated and recorded on a daily basis. The intervention focuses on the core areas affected by autism. The program provides the child with peer interaction. The program actively engages parents in the intervention. The therapist makes a clear understanding of the child's unique needs. The program involves a team which includes a physician, a speech therapist, and an occupational therapist. Lastly, I would like to talk about the signs and symptoms of autism. Alright, some of the signs of autism is no big smiles or joyful expressions by the age of 6 months, no back and forth sharings of sounds, no facial expressions by 9 months, no babbling by 12 months, no back and forth gestures such as pointing, showing, or reacting or waving by 12 months. No words by 16 months. No meaningful two-worded phrases by 24 months. Any loss of speech, babbling, or social skills. Okay, some of the symptoms ASD is characterized by social interaction difficulties. Some are communication difficulties, repetitive behaviors. Some have physical and medical issues that accompany autism. Seizure disorders occur as many as 39% with autism. Sleep dysfunction, sensory processing problems, and pica, which is a tendency to eat things that is not food. In conclusion, the research has shown that identifying and diagnosing of ASD at a young age can enable a child to begin receiving ASD-specific intervention services that will have a favorable outcome. One unique quote that caught my attention while doing my research on autism was the words autism, all in capital letters, meaning always unique, totally interesting, sometimes mysterious. And this ends my informative speech on autism. Thank you.